topic is otitis externa. Okay guys, so this is a topic today. So before starting this otitis externa, I would like to tell you briefly about the ear. That's really very important. The basic anatomy of the ear is really very important to understand what is otitis externa is. So let me quickly. Okay, the anatomy, the ear. Okay, the outer ear. It has the ear is divided into three parts. Okay, one is the outer one. The second one is the middle. Okay, the third one is inner ear. So these are the three basic parts of the ear: outer, middle, and the inner. Okay guys, the outer part, the outer consists of an auricle, auricle, okay, and the ear canal, up to tympanic membrane, This is really very important. So whatever you see from ear inside the canal and up to the tympanic membrane is the outer ear. Okay, so this is called as outer part of the ear. Then we have a middle part, and the middle part, starts from the tympanic membrane, the inside of the tympanic membrane, to the round window. Okay, to the round window. Remember. Okay, guys. So this middle ear consists of the three bones. You know very well. That's malleus, incus, and stapes. Okay. And the other things that are present in the middle ear are the opening of the eustachian tube. Okay, eustachian tube. Eustachian tube. So the one end opens in the middle ear and the other end opens in the pharynx. Okay, and this is a really very important in middle ear infection. Okay. Okay, the inner ear, the last part is the inner ear. That consists of a cochlea and semicircular canals. And these canals are really very important to maintain what you call in case of vertigo. You see you can see the lesions over here. So I'm not gonna go in detail regarding the inner ear or the middle ear. Okay, so I'm gonna start with the discussion on otitis externa, and that's a really very important topic for today. Otitis externa. Okay, I'm gonna call this as acute otitis externa because it starts within days. That's why. Okay, so now the other name for this is swimmer's ear. Swimmer's ear. Okay, and this is a condition of diffuse inflammation of external auditory canal. So suppose this is a ear. Okay, this is a ear and this goes the canal. Okay, then you have a tympanic membrane over here. Okay, the thin membrane is very thin. Okay, then the inner ear, the what you call the part starts, the eustachian tube opening. Okay, so the eustachian tube is more horizontal in children and it's vertical in what you call in adults. Okay, remember this, and that's why the children develop more often what you call a middle ear infection. Okay, so this part up to this is called as outer part. Okay, so this outer part is, if there is any diffuse inflammation of this, is known as, if there is inflammation of this, diffuse inflammation, then we call it as otitis externa, AOE. Okay guys, so this is the basic things, right? Let's move on to the etiology and pathogenesis. Etiology and pathogenesis. Okay, The lateral two-thirds of the ear canal is composed of epithelium. Okay, so it composed of epithelium with a glands that produces cerumen. Okay, it's about the lateral two-third. The middle third, okay, in the middle third, this epithelium is tightly adherent to the periosteum and there are no glands. Okay, this is regarding the lateral, and the middle third is nothing but it has epithelium but no glands. Okay, so remember this is what you call histology of this. Okay, now what happens, the cells in the cerumen migrate laterally to the self-cleanse. Okay, they migrate. The cerumen has antimicrobial property. Look at the beauty of the God. He has given us a cerumen, he has given us a glass that secretes a cerumen, and that acts as an antimicrobial agent. Okay, with the pH is low. Okay, the pH with a low pH, remember. Okay, and it also contains some enzymes like lysozymes. Okay guys, right? If there is anything, like, look at this, if there's anything related to the insufficiency of what you call cerumen, if there's any low production of the cerumen, then he may develop or he may go into acute otitis externa. This is what the physiology, what you call pathology is, sorry. Okay guys, this is really very important. Okay, if there is, sometimes what happens, cerumen level in the ear is normal, but even the patient has acute otitis externa, so there are other causes also. The other causes are like a trauma. Okay, trauma, bobby pins, trauma, very important. Remember, local trauma to the ear canals, sometimes picking and poking with the bobby pins. Okay, these are really very important. Okay, what are the organisms? Let's talk about the organisms that contribute to this AEO. Organisms in United States. Okay, in United States, more than 90% of AOE are bacterial in origins. Okay, the bacteria is the most common cause for this. So among them is the most common bacteria is, anybody can guess? Yes, it's a Pseudomonas. Pseudomonas aeruginosa. Okay, so this is a really very important bacteria you should remember, because this can be asked in entrance examination. Okay, the second most common after Pseudomonas aeruginosa is staph. Okay, remember this. Okay, you can call it as a staph aureus, the other organisms. Okay, and sometimes you can do fungi and candida also, like candida aspergillus. Okay, so these are the basic things what you should remember. Sometimes in USMLE step 1 they will ask you the type of organisms, they give the history clinical presentation of otitis externa, and they will ask you which of the following bacteria could be the most common cause for this condition. So remember, the most common cause is Pseudomonas aeruginosa. Staph can be there, and if there's any bacterial conditions that you should remember is candida and aspergillus. Okay guys, so let's talk about the second important part, that's a clinical presentation. A baby or a child is suffering from this AOE, that's an acute otitis externa, and how you represent, how you present to the hospital. This is really very important. Okay. Remember, regarding this AO, this is a rapid in onset, within days. Okay, within days. This is really very important. Then he will have what you call ear pain. Okay, if he's what you call infant, then there will be excessive cry. Okay, there will be a mild fever can be there, and feeding problems could be there because of this pain, and ear pulling could be there. Remember this. Okay, very important. The other things you can be there, pruritus, that's itchiness, and the fullness. Okay, so it is clinical features of AOE are rapid in onset within days. He will not have the complaint since months. He will have complaints since only since days, 2 to 3 days. Okay, he will have an ear pain. Ear pain in infants will be excessive cry, feeding problems. Okay, pulling up the ears. Okay, and the pruritus could be there, and fullness could be there. So these are really very important clinical features you should remember. Okay, and remember, while taking the history, you should ask about swimming. That's really very important. In USMLE, they usually give what you call history of swimming. Okay, or sometimes they give the clinical features of otitis externa and ask you what could be the cause for his problem. Is it because of his swimming? Okay, or some pharyngitis or some infection that causes middle ear infections. But remember, this is a swimmer's ear. So if there's any lesion over the what do you call an external canal, then it is external otitis externa. Okay, and then you should think of swimmer's ear. Okay, the swimming could be the cause for this. Okay, let's move on to some others. As I told you before, swimming is a main common cause, and some other cause like a trauma with the cotton swabs or bobby pins you should ask in your history. Okay, now physical examination. Okay, what you need to do is, first, before examining with otoscope, you should clear debris and serum. This is really very important, because if you see inside because you need to differentiate whether it is otitis externa or it's what you call otitis media. That's really very important, and the treatment varies. That's why. Okay, the clear the debris, serum. Okay, because, and the other reason why we clear is because you're gonna give a topical antibiotics to this patient. So if it's clear, then it will act properly and the treatment will be successful. Okay, the second reason is that. Okay, what is the hallmark? What is the important sign that you're talking about a patient with AOE is? This is really very important. This is a tenderness of the tragus. Tenderness of the tragus or pinna when you pull. Okay, not pulling heavily. Even if a patient who doesn't have the otitis externa, he will have the pain, right? So it's just an examination. If you just touch and just pull manually, okay, he will have the pain. Okay, that's really very important. Look at the tympanic membrane through the otoscope. Okay, it can be erythematous. Okay, it can be erythematous. Okay, on pneumatic otoscopy, if there is a normal movement of the tympanic membrane without visible effusion, the erythema may be attributed to otitis externa. This is really very important. Okay, what are the differential diagnoses? It can be otitis media, right? It can be malignant otitis externa, right? That's really very important. It could be a contact otitis because of a nickel jewelry. That's really very important. Some antibiotics, chemicals, plastics, remember. Okay? And it could be what you call osteomyelitis. Osteomyelitis. Okay, guys? Clear? Now let's talk about the management. How would you manage? What are the important steps you should look for? How would you manage? What are the best steps? Okay, so this is a not what you call no need to take any culture. Okay, no need to send for any cultures, and no need to start a systemic antibiotics. Rather, you should start with a topical antibiotics. That is the main treatment of this. If there is any what you call unsuccessful failure in the treatment, then you should investigate for that through cultures and through systemic antibiotics. Okay, that's why this thing differentiate this otitis externa from otitis media. Okay, so otitis externa, what you should do, you should start with the topical therapy. Okay, the topical therapy with acetic acid, because we need to maintain the pH as normal with a normal ear and alcohol. Okay, for USML examination, no need to remember what is the percentage of the acid, alcohol or acetic acid. Okay, just remember the treatment main part, that's acetic acid and the alcohol. Okay, but for your if you are a resident, then you could remember acetic acid is 2%. Okay, the alcohol could be 90 to 95% of isopropyl alcohol. Okay, that's really very important. And you can use, and you should give the antimicrobial drops, ear drops. Okay, like in the form of, it can be with the combination of the steroids or without steroids, like ciprofloxacin. Okay, it could be with hydrocortisone or dexamethasone, or combination of a neomycin, polymyxin B, hydrocortisone, or ofloxacin. So just remember for USMLE, just remember the antimicrobial agents: ciprofloxacin, okay, polymyxin B, ofloxacin. This is really very important. Okay, and in otitis externa, we don't give systemic therapy if it's uncomplicated. If it's complicated, we're gonna give it. Okay, but it's uncomplicated. Usually in the USMLE examination, they give you the uncomplicated AOE. Okay, guys. Let's clear. Okay, the other thing is, if this is a fungal, if the cause of this otitis externa is a fungal, then what you need to do, usually what happens when you're giving acetic acid and alcohol, usually it resolves with that. But if it does not resolve, but when you're examining the patient, you would see the white streaks. Okay, so if you're not confused with that, and just you can go ahead with the treatment of topical antifungal, that's clotrimazole. Okay, this is really very important. Okay, now the important things, what you should tell to your parents, that a child should be in the appropriate position, should be lying down, should be rest for 3 to 5 minutes on the side, and put the drops so that it should cover whole of the external ear canal. Okay, that's very important. Okay, and you should also tell the parents the children should avoid swimming or submerging their head under the water for 7 to 10 days. Okay, 7 to 10 days. This is really very important. And how would you know that the antibiotics are working? If there's a decrease in the pain, okay, so is there improvement within 48 to 72 hours, then you think that this is your treatment is going successful, your diagnosis was correct. Okay, so this is really very important. And the pain, you should avoid the pain of the, usually you can give NSAIDs. Okay, NSAIDs can be given for a pain as a painkiller. Okay, this is a really very important talk about this, and this is what you should know about this, what you call otitis externa. Okay, so guys, I hope you enjoyed watching this video on otitis externa. I'm sure you will thumb up our video, and I'm sure you will share our videos with your friends. Please tell your friends to watch our videos, and if you find anything, any errors, any mistakes, or anything new latest information, please do tell us. Okay guys, so thank you so much, take care, and please do subscribe and thumb up. Okay guys, thank you, take care.